Let's talk about genital warts, also known as condyloma acuminata. They are a sexually transmitted infection caused by the Human Papillomavirus type 6 and 11. These strains are transmitted through sexual contact, including vaginal, anal, or oral sex. Genital warts can develop on the vulva, the vagina, the cervix, penis, scrotum around the anus. They are characterized by small flesh-colored or grayish growths that appear on the genital area or around the anus. Several risk factors increase the risk of developing genital warts, and they include having unprotected sex. Genital warts are most commonly transmitted through sexual contact, especially when no barrier methods such as condoms are used. The risk of contracting HPV and developing genital warts increases with a higher number of sexual partners. Individuals with weakened immune systems, such as those with HIV/AIDS or who are undergoing immunosuppressive therapy, are more susceptible to developing genital warts. Genital warts are most commonly diagnosed in individuals between the ages of 15 and 28. Smoking has long been associated with an increased risk of developing genital warts and complications from the HPV infections. The symptom of genital warts can vary and may include small flesh-colored or grayish growths on the genital area or around the anus, clusters of warts that resemble cauliflower, itching or discomfort in the affected area, bleeding during sexual intercourse, which is actually rare. Diagnosing genital warts typically involves a combination of methods, and they include a visual examination. Here, a healthcare provider will visually inspect the genital area to identify the presence or absence of warts. A solution of acetic acid may be applied to the genital area, causing warts to turn white and become more visible. In certain cases, a small sample of tissue may be thickened and examined under a microscope to confirm the diagnosis. Treatment for genital wart focuses on removing the visible warts, relieving symptoms, and reducing the risk of transmission. Prescription creams or solutions, such as the use of podophyllene, can be applied directly to the warts to promote their elimination. Healthcare providers may perform procedures to remove warts, and these include the use of cryotherapy, electrocautery, or surgical excision. Certain prescription treatments can be applied by individuals themselves at home, following healthcare providers' instruction. After treatment, regular follow-up visits are important to monitor for recurrence and assess the response to treatment. After treatment for genital warts, follow-up care is essential to monitor for recurrence and to prevent transmission. Additional prevention methods include safer sex practices, consistent and correct use of barrier methods including condoms during sexual activity can reduce the risk of contracting and spreading HPV. HPV vaccines are available to protect against the most common HPV strains associated with genital warts and certain types of cancers. Vaccination is recommended for both males and females before initiating sexual activity. Regular screening for cervical cancer, such as the use of pap smear, are crucial for early detection and treatment of abnormal cell changes caused by HPV. Avoiding sexual activity or practicing abstinence can reduce the risk of HPV transmission. Genital warts are a sexually transmitted infection caused by certain strains of the Human Papillomavirus. They can be highly contagious and can cause physical discomfort or emotional distress. Understanding the causes, symptoms, diagnosis, treatment options, and prevention strategies for genital warts is crucial in managing the infection, preventing transmission, and promoting sexual health. Regular checkups, open communication with healthcare providers, and practicing safe sex can contribute to overall well-being and reduce the risk of genital warts and other HPV-related complications.